How to think like a prosthodontist. Prosthodontists are faced with new challenges every day. Um, so the important thing is that we've learned is to take what you already know and work with it. Um, so for a prosthodontist, you're going to need to know your instruments. You're going to need to know your materials and their properties, their characteristics. Once you know that really well and are familiar with it, you can then kind of deviate from just kind of regular protocol and be creative with it. You got to think outside the box. Think of the best way to solve a problem. Be a little bit creative. The best ideas come with a bit of time stress, but not too much. When we were faced with time stress, we were forced to really think quickly, and prosthodontists don't have all day to think about how to solve a problem. So they are indeed faced with time stress. But if you have too much, then it just gets too stressful, and you might have diminishing returns at that point. Crazy ideas activate the creative juices, and who knows, maybe a crazy idea may even work too. So yeah, you want to just kind of even think of some crazy ideas that just might work. But even if they don't, at least you're thinking, at least you're exploring, and then maybe you can kind of take one of those crazy ideas, tailor it a little bit, and actually make something that can work out for you. So let's talk about the two ideas that I had in class: the bitter child custody stroller and the credit card strip. And here's my solution to the credit card strip problem.
Oh, I thought she was filming herself.
No, sorry. Okay, I hate when my wallet wears off the magnetic strip of my credit card. On phones, you have that little protective coating, and when you go, they like swipe it like a million times and it never works because the magnetic strip's ripped off or stripped off, whatever. So I want to put plastic coating over that, just like they do with a plastic bag. They swipe your credit card with a plastic bag. So put that same kind of stuff. Look at that. As you can see,
Perfect.
this artist rendition of the credit card will have that protective coating right over the magnetic strip, so it won't wear out. And my other idea is a remote activated mini mace bomb that you can blow up on anyone that steals your credit card.
I like that.
This next video is called the Problem Solving Denture, and it's just an exercise in thinking like a prosthodontist. Rice Krispies denture. Hooray! Ingredients: throw them together to make Rice Krispie treats. Spray your stone model on fingers first so it doesn't get too sticky. Form the denture onto your model. Round off the edges, make it smooth, look nice. Place the teeth appropriately, even though I didn't because I got them backwards. Oops. But when you're done, you get to eat it off. Yay! Here's how I felt after wearing a fake denture for a day. Okay, I just finished the wearing a denture thing, and it was miserable. Didn't enjoy it, but I learned a lot from it. It helped me kind of see just how miserable it is to wear. It didn't quite fit right, so it kept falling out. So I hear a lot of denture wearers coming in and saying it's painful or doesn't fit right. And I thought for a while that would be really annoying. But now I understand why. I mean, it just has to fit, and it just has to, I mean, it's humiliating. I kept having to like push it in, and I just kind of felt dumb. My speech was off. I had a lisp, and I gagged a lot because of it, because I'm a gagger. Types of food were limited as well. I just need to fit well in order for it to be a successful denture. In order to keep your sanity, it would just have to fit well. If there's any way to get it off my palate, that just bothered me like crazy. Maybe with implants, I don't know how it works, but I'm excited to find out and to learn. Thanks. There are many different types of prosthodontics. You could definitely choose to go edentulous and just not get anything. But obviously socially that's going to be, it might be awkward for a lot of your patients to just live their life with no teeth, but it would definitely be the cheapest. You can get a normal denture. With that, you have much less force than you could get with like the fixed, but it's the cheapest option, and it's easy to clean. As you can take it out quite easily, but it can fall out when you don't want it to, so that's not good. Overdenture has the couple implants um, to help it stay on, so you can still clean it, so that's good. It stays on better, so socially that's a bit better. Um, that will cost you 5 to 10,000, whereas the regular denture is about 1,200. There's the hybrid that stays in quite well. That's going to be 15 to 25,000. Physiology and psychology on that are actually good for your patients. And fixed is by far the most expensive, 20 to 30,000. But it has good force potential and good uh, retainment, but it can be hard to clean. So there are your options. What is idealism? Idealism can be difficult because to different people it can mean different things, but for us, we're going with the idea of kind of the survival of the fittest. That things need to survive, they need to maintain their health, and they need to attract a mate in order to reproduce. Um, Function equals health in most cases. So you take like this peacock here, who's got all these feathers, and it does two things for the peacock. One, it fends off predators, and that would be survival and health. Two, it attracts mates, and that would increase its chances of reproduction. The reason it attracts mates is because it recognizes that it is more this particular peacock is more likely to survive because it has this factor. So they're kind of there's kind of an interplay there that relates to humans as well. As far as idealism, we have broken it into three different categories. Macro aesthetics, and that's the relationship of the teeth to the face. So if you see the picture on the left there, teeth really do affect the overall shape of the face and the overall beauty of a person. Basically, that's going to be an oral surgeon's job. The general dentist or prosthodontist doesn't deal much with, um, lengthening alveolar ridges or things like that. But that would be macro. Mesoaesthetics is the relationship of the teeth to the lips. General dentist, prosthodontist, that's us, would be doing that. And if you see the picture there in the middle, Tom Cruise, the midline of his teeth isn't quite centered on his face. That's something that you wouldn't notice right off, but if you look closer, you can see that. Whereas macro is kind of the general feel. You could see that from 5 feet away. And finally, we have microaesthetics, the relationship of the teeth to each other and to the gingiva. And your lab technician is who mostly deals with that. You give them specifics and help them out, but they're going to set the teeth and figure that out. But if you see the picture on the right, you can see parts of microaesthetics where the teeth relationship to each other and the gingiva isn't quite perfect or ideal, in that we can see that black triangle, which is a nuisance to patients, and is not beautiful. In summary, for that idealism, you need function, because function shows that you will have health, that you will survive, that you can eat, you can find food, you can do the things necessary to survive and reproduce, and that is beauty. To achieve idealism, we follow a stepwise approach. We call it dressed to the nines. And there's a meso and a micro approach to that. For the meso, which is what we will definitely be focusing on, the first step is to check for the buccal lingual position of the maxillary central incisors. And to do that, you look from the side to see that the angle's positioned right. That's a lot of aesthetics there, to see if it looks right. But then sometimes the shape of the mandible and the maxilla, you kind of got to work within the parameters of their anatomy. to make sure that they have function. So it's a balance of function and aesthetics. But too far out doesn't look right, and then it can also affect the S sound particularly, but just overall speech can be a problem if that's not properly done. Number 2 is incisal length of maxillary central incisors. 3 is maxillary occlusal plane angle. Use the Camper's plane or bottom nose tragus. 4 is buccal corridor, and that is where you how much teeth you can see on the sides of the mouth, especially when you smile. You're going to want the edges of your teeth to line up with the medial part of your irises. The maxillary midline position, and 6 is maxillary midline angle. That can be tricky. You generally do it based off the philtrum, which is usually centered and straight, but sometimes it's not. In which case you need to balance the science and the art. Make sure you keep function, but make sure it looks presentable and good. 7 is the zenith line, which gets higher as you go posteriorly on your teeth. 8 is buccal lingual position of mandibular central incisors. And number 9 is incisal length of mandibular central incisors. And you kind of want to use that waterfall approach for those to get that angled properly. As far as the mesoaesthetics, there are also 9 steps to consider. The first is central maxillary papilla midline. The second is midline perpendicular to incisal edges. The third is proportions of the maxillary central incisors. Fourth is widths of maxillary anteriors. 5 is length of the maxillary teeth. 6 is apical progression of contacts and embrasures. 7 is harmony of posterior cusp edges. 8 is symmetry of zenith and antizenith positions and angles. 9 is the length of the papilla. Now again, these are more for the lab technician. However, in dental school, we will be setting our own teeth, so these are important. As far as interest of time, since I'm running over 20 minutes, I will just have notes on these separately, but it's important to go over these. There's formulas and calculations of exact lengths and widths that you want to look over, especially. Well, not especially, but number 9, length of papilla. You want that to be 40% of the total tooth length to avoid that black triangle that was discussed earlier, which again is very uncomfortable. It can form spit bubbles. It just impedes speech and is just very, very annoying. So that's stressed to the 9's mesoaesthetics. The steps to making a denture are as follows. The first is to take an alginate impression of your patient. The second is then to use that impression to make a stone model. You can see that in the lower picture there. And to then, from that model, use triad to make your base plate. You can see here in this picture, this is a lower arch. Form the wax rim on the triad. Apply adhesive, and then put PVS on it. Heavy body first, then light. Place the rim in the patient's mouth and do the P90X so that you can get good anatomy and that the patient will be comfortable with it in, and then confirm anatomy has been captured. Dress to the 9's. Buccal lingual position of maxillary central incisors, as you see on the right. Get the waterfall so that it doesn't look like horse teeth, as you can see there. 2, incisal length of maxillary central incisors need to be accurate, so you need to heat it up and melt it down if you need to. Adjust the maxillary occlusal plane angle as well as the buccal corridor appropriately. Set the maxillary midline position, the maxillary midline angle, and the zenith line. Set the buccal lingual position of mandibular central incisors and the incisal length of mandibular central incisors. If you're going to be sending it to a lab, take a bite registration to see so that the lab will know what the occlusion looks like. That'll kind of lock it into place, or you can place the teeth yourself. If you're going to set the teeth yourself, put it on an articulator and then put the teeth in according to the microaesthetics we talked about earlier. Then make sure, like in the Wiscott article, make sure you've got good anterior guidance so that your posterior cusps are able to have good clearance as you protrude and extrude. And then make sure that you check for occlusion. Occlusion isn't going to be quite as in depth as in regular mouth, but make sure that both sides are coming down on both sides are coming down with equal force. Once the teeth are set, you can try it in and then adjust accordingly so that they don't look weird like Ross does in this picture. If you like it and the patient likes it, you're all done. What can go wrong with the denture? Well, in most people, resorption can happen. It's often caused by periodontal disease, aging, and tooth loss. So for someone who's a dentulous, the bone decides to resorb because that has no purpose in maintaining that alveolar ridge. Consequently, you may need a reline where when your denture doesn't fit quite right, you can go get a reline, and that's where you resurface the gingival side of a denture with new material for a better fit. Or you may need to get it rebased, which is like relining, but you replace a larger portion of the denture base. Then there's two kinds of, we've got immediates, which is the denture that is used after teeth are extracted, and interims, or a flipper. Those are usually temporary substitutes for the teeth before the permanent bridge is implanted. Dentures can go wrong in a lot of ways. They can snap in half, or even just the abutment, the little snap-in can get loose. We did a break repair in one of our classes, but for our dentalism class, this is the repair that we did, where we took out that loose abutment and then replaced it with a new one. Professionalism. Okay, before I talked about professionalism, in my opinion, is conducting yourself in a manner that shows your confidence, your honesty, and your competence. And I think those three show your patient that they can trust you and that you'll do a good job for them. But I also wanted to add, now I want to add, putting your patient first, letting them know that they are your highest priority. I think that's huge in professionalism, so that not only do they trust you, they know you can do a good job, but that you are putting them number one. And then also to have the confidence to admit when you don't know. And if you don't have the knowledge or the ability to do something, you go out and you get that knowledge or ability, or you go ahead and refer to someone that does. To me, that's true honesty and true confidence. How would I improve the edentulous experience? I keep toasters and toilets in mind throughout my career to remember to always think innovatively, come up with new ideas, and research them, see how they work. I need to stay current on my scientific research, do what's best for the patient. I want to create a website for people considering or about to receive dentures, so they can hear from denture wearers what it's like to have a denture, so that they're prepared. They know what they're getting themselves into, and then also discuss shades, so that people can kind of see like what it looks like when they choose a color that's too white, that it looks fake. Have food suggestions for them that they can eat and they can manage, perhaps especially at the beginning when their gums are sensitive. Then frequently ask questions and helpful tips for those who are edentulous, as far as maybe cleaning and other things. That way people don't feel like they're alone. I imagine that wearing a denture is quite a life-changing experience and something that they could use support on. And then with my TED Talk, I want to do an implant substitute for patients on bisphosphonates and or resorbed ridges. It's tough to really drill into their bone when they have a hard time healing or just don't have anything to drill into. So, as mentioned in my TED Talk, maybe some kind of thing that wraps around the mandible, so you're not having to penetrate through it, but somehow you could go around it and hold it and really fasten it tight onto the mandible, so we have